All right, so picture this. You're working your shift in the ER, and that call comes over the radio from triage. Patient bee sting. Feeling a bit woozy. Maybe their voice sounds kind of funny.
Okay, happens all the time.
Right. You think, okay, bee sting, but then like a minute later, things get frantic. They went from walking and talking to suddenly being on a stretcher, kind of circling the drain.
Yeah.
And you just know, that feeling. You have to move now. This isn't a time to sit back and ponder the differential, is it?
Not at all.
This is one of those like freight trains we see. Just barrel through the ER. There's zero time to waste. You got to act.
Absolutely.
So today, yeah, we're doing a deep dive into exactly that, anaphylaxis. We want to navigate this this whole critical emergency, really understand the physiological chaos that's going on. And most importantly, zero in on what you absolutely have to do right now to save a life. Because honestly, in our world, those first few seconds, they define everything.
That's right. And what the sources really highlight for us, especially as ER nurses, is it doesn't really matter what caused it. Bee sting, peanuts, latex, whatever.
Right.
The big picture reaction, the systemic thing, and importantly, the first steps in treatment. They're basically the same.
Okay.
Think of it like the body's security system just going completely haywire. Yeah. An allergen gets in and bam. Instead of a targeted little response.
It goes nuclear.
Exactly. It launches this like full-scale attack on itself, and that triggers this massive, just system-wide release of histamine and, well, a bunch of other chemicals all at once.
Okay, so that chemical dump is what causes the chaos.
Precisely. And that leads to something we see a lot, widespread vasodilation.
Yeah.
But the key here is how incredibly fast it happens.
Right.
All those blood vessels suddenly widen up, fluid just pours out of the bloodstream into the tissue.
So they're third spacing like crazy.
Like crazy. And your circulating blood volume just plummets, which is why you get that sudden, terrifying drop in blood pressure, that hypotension.
And the swelling.
And the swelling, potentially closing off the airway in just minutes. It's not localized. It's this whole systemic cascade that starves the organs of blood, of oxygen.
Yeah.
It's bad.
And what really jumped out from the sources, something that honestly trips people up sometimes, even experienced folks, is what this actually looks like. We all have that textbook image, hives, swollen face.
A classic picture.
Exactly. And yeah, that happens a lot. But you just can't count on it. The research we looked at showed like a 1 in 5 chance, 20%, that these patients have no skin signs. None.
That's a huge point. 1 in 5.
So if you can't rely on the rash, what else? What are those like less obvious clues the sources say should still be screaming anaphylaxis at us?
Yeah, that's so critical because catching those atypical ones saves lives.
Yeah.
So beyond the obvious stuff, the sources really push us to look for other signs of systemic trouble.
Like what?
Like, is there just sudden, profound weakness out of nowhere? Patient was fine, now they're dizzy, maybe disoriented.
That sense of impending doom people talk about?
That too. That feeling like something terrible is happening, or just, an unexpected drop in blood pressure. No other clear reason for it. If you've got any suspicion of allergen exposure, plus those kinds of systemic changes.
Act.
Get them flat on a stretcher immediately. Hives or no hives, if the pressure's dropping or their mental status is changing, you know the drill.
Okay, so we've recognized it. Maybe it was subtle, maybe obvious, but we see the freight train coming. What's the absolute next non-negotiable move?
Yeah.
Because it gets chaotic, right? And you can get sidetracked.
Easy to do.
But the sources are just crystal clear here. It's like put your brain on autopilot for these first couple of things because nothing else matters in those first moments.
That's exactly right. There are really only 2 tiers of treatment here, and you absolutely have to know which one saves the life right now.
So tier 1.
Tier 1 is epinephrine. Full stop. This isn't a maybe. It's the first line, life-saving, non-negotiable step. You grab that 1 to 1,000 epi vial, drop 0.3 ml, that's 0.3 milligrams, and you give it IM. Straight into the vastus lateralis, the outer thigh.
Outer thigh preferred.
Preferred, yeah. Big muscle, good absorption. Or the deltoid if, clothes are in the way and you can't waste a second. The sources stress that. Don't delay just to get pants off. Get the medicine in.
Okay, get it in.
And then you watch closely, see how they respond. And you can repeat that IM epi every 5 minutes if you need to, based on how they're doing in your orders. This is the absolute first responder. Nothing beats it.
That priority is just so clear. Epi first. But, we're also thinking about symptoms, comfort. When do those other meds come in? The Benadryl, the steroids. I've seen people reach for Benadryl.
Oh, yeah. That's a classic pitfall. We've all seen it.
What's the danger there, besides just wasting time?
Well, the timing is everything. After you've given that life-saving epi, after you've at least hit pause on the reaction, hopefully start reversing it, that's when you think secondary. That's when you can give the Benadryl, maybe some Pepsid, some Solumedrol, the antihistamines, the H1 and H2 blockers. They help with the itching, the hives, makes the patient feel better.
Right, comfort meds.
And the steroids, like Solumedrol, they dampen the overall inflammation, maybe help prevent that biphasic reaction later on.
But they're not saving the airway now.
Exactly. That's the crucial point from the sources. They are purely secondary, important. Yes, for later care, for comfort, but not for immediate life-saving. Benadryl, for instance, takes, what, at least 5 minutes to even start working?
5 minutes too long if they're crashing.
Way too long. A crashing patient doesn't have 5 minutes. None of those secondary meds. None will open a closing airway or fix that tanking blood pressure.
Right.
They're the cleanup crew. Vital, sure, but they follow the first responders.
Okay, makes sense. But sometimes 1 or 2 shots of IM epi, it just doesn't cut it. Things get really scary then.
They do.
Right.
When that happens, when the IM epi isn't enough, the sources call that refractory anaphylaxis. It's persistent, severe, despite doing the right first steps.
So what now?
Now, if you haven't already, you need a second large-bore IV, like yesterday, and start pouring in fluid. Normal saline, LR, whatever you grab first. Doesn't matter.
Just volume.
Just volume, because remember that fluid shift. Physiologically, they are bone dry. Even if they just drank a gallon of water, flood them with volume. And keep them flat, maybe even Trendelenburg if that pressure is still low.
And medications.
Yeah. The next step is usually thinking about an epinephrine drip. Escalating care, getting ready for the ICU. And let me just hammer this home, something every single one of us needs burned into our brain.
Okay.
Never, ever, ever give IV push epinephrine unless the patient is coding, actively in cardiac arrest.
Why not?
Because giving IV push epinephrine to someone with a pulse is an incredibly efficient way to throw them into VTACH or VFib. It's a recipe for disaster. That is not a drug you push casually. Drip only unless they have no pulse.
Got it. Drip, not push unless they're coding. Okay. So let's say we stabilize them. Things are looking better. What about longer term? We figure out the cause, maybe. Right. You talk to the patient, family, get the story. If it was something like a bee sting, they're away from the trigger, then mostly you monitor. But what if they ate something?
Like the strawberry allergy example you mentioned.
Exactly. Someone allergic who thought, it's been years, I'll try one. Even if they throw up right away, the sources say it doesn't really help clear the allergen effectively.
So they're still at risk.
High risk. These patients need close monitoring. As that allergen moves through their system, it can keep triggering the reaction. As your initial epi wears off, boom, they can backslide. Airway compromise, hypotension again.
So they might need more epi later.
Very likely. Expect multiple doses, maybe needing that epi drip, probably heading to the ICU to manage that prolonged risk.
Yeah.
You can't let your guard down just because they look better initially with ingested allergens.
Okay, that's a really important point about ongoing risk.
So, just to boil it down again, the core actions for us in the ER, non-negotiable, what are they?
Epinephrine, immediately.
Yeah.
Get them flat, maybe Trendelenburg. That's it.
Yeah.
Those two actions. Above everything else, they save lives, period.
And it really boils down to that difference, doesn't it? The life-saving first responders, that's your epi, and then the cleanup crew, Benadryl, Pepsid, Solumedrol.
Exactly.
They're important later for comfort, for inflammation, but they can wait. They have to wait until you know you've started turning this thing around. That quote from the source material really hit home. Get those first 2 things right in the first 60 seconds, and you've given your patient the only chance they've got. Miss it.
Yeah, and it's the only chance they'll have left.
Yeah,
Powerful stuff.
really is.
So maybe you think about this for a minute, taking it beyond just anaphylaxis. The sources kind of challenge us implicitly, right? What does it really mean to be?
Yeah.
Well, to execute with that kind of speed and precision every day in the ER.
Like being Lightning McQueen, but in scrubs.
Sort of, yeah. How can we apply that mindset, that rapid recognition, even without the classic signs sometimes, and that immediate decisive action on the most impactful things first? How do we apply that to other critical situations we face?
Yeah.
What does it look like for you to consistently prioritize what truly matters most, especially when the clock is ticking? It's about being that ultimate first responder, isn't it? Every single time. Something to think about.